Good afternoon, everyone. My name is Nisa Shafi. I am the head of policy and advocacy at the Allergy and Asthma Network. On behalf of the network, I'd like to thank you for joining us today as we discuss what you can expect during your time on the Hill with us next week. I'm going to give it a few seconds for others to join the webinar, so please bear with us. If you are able to use the chat function, we'd appreciate if you can let us know where you're logging in from while we get settled. So we'll get started in just a moment. Hi, Alicia. Thank you. Thank you, Paige. Wonderful. Thank you so much. And please continue the roll call going. It's lovely to know where everyone is coming in from. So again, I'd like to reiterate that we'd love to thank you all for joining us today as we go over some of the logistics for next week. And we just are incredibly thankful that you're joining us for our annual Allergy and Asthma Day on Capitol Hill that we also affectionately refer to as AADCH. Additionally, I would like to extend the network's appreciation to the American College of Allergy, Asthma, and Immunology for their consistent support of this event. This year, we are celebrating over 40 years. Last year was our 40th anniversary, so we're continuing our advocacy in the allergy and asthma space, as well as related conditions. And for over 4 decades, advocates like you on the call today have helped spread the word on key legislation and policy with your representatives to help empower and equip individuals living with these conditions. So we're thrilled to meet you next week. And before we get started, I just wanted to go over some housekeeping items. So the Zoom call is scheduled for an hour. We will probably finish earlier than that to allow for some question and answer and discussion if possible within the chat. In order to minimize, this is a webinar, so I don't think there's a feature enabled to speak, but please utilize the chat function and let us know if you have any questions about the logistics shared today. And finally, this webinar is going to be recorded. So if you want to refer to this information later, you can do so. For your speakers today, you're joined by myself, Nisa Shafi, and I'm also joined today by Kevin Schultz, President of Soapbox Consulting. Kevin is going to walk us through all the logistics that you will need to be aware of so that you feel prepared and confident going into your meetings on the Hill next week. And in our next slide, we'll learn a little bit about Allergy and Asthma Network's mission. So our mission is to advance patient-centered research and advocate for better outcomes, access to care, education, and treatment that lead to improved health and quality of life for everyone impacted by allergies, asthma, and related conditions. And going into the next slide, we have 4 key mission areas, and that is to conduct community outreach, facilitate educational resources, lead patient-centered research, as well as advocacy, which is why we're all here today. And next slide, please. Our advocacy operates within 3 key lenses, and that is to advocate for legislation that ensures better access to healthcare, affordable medications, and treatment. We do this by collaborating with regulatory agencies to bring awareness to the specific conditions and situations that our patient community is facing. And the third and most important, given what we're going to be doing next week, is to mobilize advocates to participate in legislative efforts and share their personal stories to shape policy. So a lot of the advocates that we're going to be joined with, we're going to be advocating with next week, have lived experience with these conditions, and we really rely on the stories that you're comfortable sharing during your Hill meetings to help drive a lot of the policy forward. So Your lived experience and your situation is really critical to helping bring light to a really complex policy landscape. So we really appreciate the time and effort that you're spending to be with us. And next slide, please. Allergy and Asthma Network has 4 key priorities, and we'll dive into how we're going to communicate those in a little bit. And that is to improve access to affordable and accessible medical care and treatment. We work towards increasing funding for federal asthma control programs. Our goal is to reduce emergencies related to asthma and allergy events, and also to mitigate environmental hazards that exacerbate symptoms for patients in this community. Next slide, please. So in your documents, I sent over a packet of information for everything you'll need to feel prepared during your Hill conversations. And a part of those suite of documents are going to be infographics or statistics that you'll receive that help illustrate the prevalence of the disease states that we're going to be advocating for. So as you can see, this one is specific to asthma. Over 28 million individuals have asthma throughout the country. And every set of these infographics help illustrate the disease burden, the morbidity, mortality, or how sick everyone is with this illness and how many people die each year because of it, left untreated and due to complications, the economic burden, how much this condition costs the healthcare system in general, and what are the societal impacts for the disease itself. So as you can see, 1 in 3 adults deal with asthma, report having missed work days. 1 in 12 children have missed school days because of their symptoms. And it is the #1 cause of missed school days per year among children. So a lot of these statistics will help you drive the point forward to help link what you're also experiencing with the condition itself and express what you need to see changed. Next slide, please. This one, similar to asthma, expresses the prevalence of severe and life-threatening allergies. So you'll see a lot of statistics here that deal with food-related allergies and the burden related with that. So as you can see, $33 billion a year are spent in direct medical expenses due to adverse events for severe allergies. And unfortunately, we experience close to 225 deaths a year due to allergies. It shows the cost of anaphylaxis and the consequences of not having immediate treatment. So a lot of these statistics will help drive that point forward for you. The next one is going to be on eczema and atopic dermatitis. Similar concept here. We're going to go over the prevalence of the condition, what individuals experience when they have severe or moderate symptoms, the economic burden related to that, the common demographic in that disease state, as well as which adults or which populations are more susceptible or vulnerable in this disease condition. And the final one is going to be on seasonal allergies. Same thing here. We're going to talk about the disease burden, the economic impact, and the overall societal impact of navigating the condition itself. So all of these numbers are meant to help strengthen your argument when you go on the Hill. It just helps give you a statistic to highlight in your talking points that we've provided to give you confidence in what you're going to be asking for. Next slide, please. Now we're going to go into some of the key messaging that we're going to be expressing during our Hill meetings. So our 3 points are to make medications more affordable, healthcare more accessible, and improving medical research. We want to address the situation of high healthcare costs and complicated insurance rules that make it harder for individuals to get the medication they need. We also want to highlight that because costs are so high and insurance is complicated to navigate and access medication as prescribed due to various insurance practices that are at play, patients end up skipping doses of their medications. They end up using less than prescribed to help make it last longer. And they're not adhering to their medication in the way that their doctor intended, which of course diminishes their health outcomes or the progress they can make with the medication if they took it as prescribed. So we want to make sure we're highlighting the cost to patient health when it comes to having a high cost related to health insurance in general. We want to make sure that we're highlighting the importance of having accessible healthcare. So just because you have healthcare available to you, it does not mean that it's accessible in the way that you would need to sustain a healthy life. And also highlighting that people with asthma and allergies need continual care, and that requires specialists and exams and the right medication. And finally, we want to highlight that medical studies and research should include a broad range of Americans that demonstrate the treatment's efficacy in the population that's meant to receive that treatment path. So ensuring that research studies are taking into account different populations so that when a medication is prescribed, it's most effective for those that need it. And next slide, please. We're going to go over some of the key priority bills that we will be advocating for on the Hill next week. And two of them on the screen today are going to discuss a lot of the high cost measures that I discussed before, and that is the Safe Step Act, and this helps improve insurance step therapy protocols. So if you have ever dealt with your insurance company not approving what your doctor has prescribed, and you've had to go through several different treatments to ensure that you proved that the previous treatment was ineffective to basically step up to the treatment your doctor originally prescribed, that costs time, money, resources, and it is a burdensome experience for patients and physicians. So to help eliminate some of the tension and the administrative burden that comes with this, the Safe Step Act helps shorten the approval process for the therapies that are being prescribed so that patients can get to the drugs they need faster. Then the Help Copays Act is another insurance-related bill, and it helps individuals afford their treatments by allowing their copay assistance to count towards their deductible or their out-of-pocket maximum. Previously, that wasn't the case. So we want to make sure that the money that patients are paying towards their medications out of pocket through copay assistance programs are accounting towards their overall insurance plan. And going into the next slide, we're going to discuss GEO's law, and this is a legislation that helps establish a federal grant program that will provide training and funding for first responders to help with epinephrine administration in critical situations involving anaphylaxis. So first responders, as in police officers or firefighters who may reach the scene of an emergency sooner than an emergency EMS vehicle or ambulance would. So this would help bridge that gap in critical timing needed to administer epinephrine. And then we have the One School, One Nurse Act, and this helps to ensure that every school is staffed with a nurse. That's not necessarily the case in every area. Some regions share one staff nurse amongst many schools. So we want to make sure that in the case of mitigating asthma and allergy related conditions and emergencies, that students have help they need before situations get worse. Next slide, please. And then we have some funding requests going into our meetings for 2027. And these are for the National Asthma Control Program. We're requesting 40 million next year. We were successful to get 33.5 million for 2026. So we're asking for an increase in funding to support federal asthma-related resources and education and training. And then for the National Institutes of Health, this is to support critical research programs that help the allergy and asthma community. And then we have critical funding requests for the continuation of CMS, or Centers for Medicare and Medicaid Services, federal healthcare programs to support those endeavors, as well as the Environmental Protection Agency for air quality initiatives. And then we also have Healthy Homes initiatives for housing stability and safety, and a number of other requests. But we've been active in a lot of these areas to help build up to these requests. So with regard to the EPA, we've helped testify on your behalf for clean air standards. For Medicare and Medicaid, we've helped provide testimony for affordable medications in the Medicare space, with recent approvals for asthma and allergy medications. And of course, for the National Asthma Control Program, we continue our advocacy there. So when you express these priorities next week, you will have that knowledge that we've already been doing a lot of the work there as well. Next slide, please. For the day itself, we request that you engage on social media. So we have the handle on the screen, as well as the hashtag. We will provide a social media toolkit for you so that you are able to retweet or share any of the messaging that we are going to be spreading across all channels going into next week. So you can be engaged virtually as well. And some meeting tips going into the Hill meeting. So these are really important relationship building opportunities for both our advocates and for Allergy and Asthma Network to help continue advocating for this important community. So make sure that when you have your meetings, you're introducing yourself, your name, and your town. You're providing information based on the materials given to you on Asthma and Allergy Network's Allergy and Asthma Network's key issues, requesting support for pending bills, like the 4 priority bills that I mentioned earlier. Please, please, please share your personal stories. This is really critical in getting Hill staff to engage with their bosses to help advance a lot of the legislation that we want to get passed. And try to be respectful as possible. You're going to be meeting with members of Congress that you potentially might not agree with, but these are really important steps to the civic engagement process, and it's important that we have productive, respectful conversations. If you can summarize any of the commitments made by the member or staff during your meetings, Kevin's going to go into some information later about how you can input the experience you had in your meetings through your Soapbox tool or the app. That would be really helpful. And then, of course, to maintain that relationship going forward, just please say thank you and be open to having continued conversations going into next year. Next slide, please. A little bit about the agenda going into the event. So we have a welcome reception on May 5th on Tuesday, and that's going to be at the Hilton, Washington, D.C. Capitol Hill Hotel. And we're going to be meeting in the bar area. And the address is located on the screen, and you should receive all these materials as well. And then the next day, we're starting bright and early at 8 a.m. Same hotel, same venue, but we're going to be in the Atrium Ballroom, and that is going to be our breakfast briefing. So you're going to get a part 2 of myself and Kevin giving you some logistics for the day, as well as hear from our CEO, Linda Mitchell, and the leadership from the American College of Allergy, Asthma, and Immunology. And then we have booked some media engagement and a photo opportunity on the Hill. So at 9:15, we're going to break, take some shuttles that are going to be provided for us, go to the Hill and have an opportunity as a group to take a picture on the steps of the house side of the hill. And we have media there. So if you're able to share your priorities and why you're part of the event with them, and we welcome you to do so. Then we'll split up, go to our meetings for the day. So you'll have assigned meetings throughout the course of the day. And we'll reconvene at 11:45 at the Rayburn House office building. And that's when we'll have the second part of our programming, and that's going to be our congressional lunch briefing. And you'll hear from a whole list of speakers, which I'll go over in the next slide. But after the lunch briefing, we'll split up again and resume our meetings and wrap up for the day. I mentioned that we're meeting on the House side of the Capitol, so this map just helps highlight where we're going to be. We're going to be on the intersection of First Street, Southeast, and Independence Avenue. The shuttles are going to be picking us up from the hotel at 9:15. So we'll have coordination for that as well when we're wrapping up the breakfast briefing. And then, like I mentioned, we're going to meet for the media opportunity and then reconvene at 11:45 to continue the rest of the day's programming. For our speakers, you're going to hear some video remarks from the co-chairs of the Congressional Asthma and Allergy Caucus, Representatives Debbie Dingle from Michigan and David Valadeo from California. So they'll provide their perspectives on the caucus's priorities for the allergy and asthma community for the second session of the 119th Congress and what they plan to continue into the next session. Next Congress, sorry. And then, like I mentioned, you're going to be hearing from the American College of Allergy, Asthma, and Immunology and their leadership. So Dr. Sherry Zachary, the president of the college, is going to be speaking in the morning. And then you'll also hear from Dr. Wes Sublett, who is the chairman of advocacy at the college. So they'll provide their perspectives for the professional leadership and providers that they represent in this space. You'll hear from patient testimonies, representatives that are going to provide testimonies on their lived experience and just their overall experience in navigating patient's condition in this space. So we'll hear from Georgina Cornago. She is the mother of Giovanni Cipriano and a huge proponent of Gio's Law, and we'll get into how significant that is as well during the course of the event. But I mentioned during our legislative preview of the bills that we're supporting, Gio's Law started out as a state legislation, state law in New York, and is now a federal proposal. So we are incredibly excited to hear from Georgina's perspective on that. And then Elizabeth Elliott is going to provide perspective on what students face living with asthma in schools. So she will provide some context into what we need to help support students and build stronger school infrastructures to make sure that kids are healthy and safe when they have these conditions. And then we get into our panel discussion. Our theme this year is affordability and access. So our panel will feature another member of leadership from the college, and that is Dr. J. Allen Meadows. And we'll hear from Dr. Payal Gupta, who is the co-host of the AADCH podcast, and Jennifer Dexter, who is the vice president of policy from the National Health Council. So we're excited for you to hear from all of these experts and distinguished guests. Next slide, please. Like I mentioned yesterday, you should have received a packet of materials that go over some programming details. So you'll have your agenda, you have the policy priorities and requests that I've listed and kind of explained earlier on. You have a sheet of advocacy do's and don'ts. They're just general tips on how you should conduct yourself in these Hill meetings, and then the statistics pages that I mentioned earlier. There is also a sheet in there that gives you a background on the National Asthma Control Program. This is a critical federal program that Allergy and Asthma Network advocates for and engages with. So please read that as well so that you're able to make that appropriations or funding request. Couple of things to note when it comes to attire. Please make sure you're in business or business casual attire. Wear comfortable shoes if this will be your first time in DC. We have long DC blocks, so make sure that you're dressed comfortably. Make sure you check the weather, of course, and that you're dressed properly for the day. And in every federal building, you're going to come across medical detectors. So be mindful of what you're wearing and what you are carrying with you. And finally, like I mentioned many times, your voice is what's going to help move the needle on a lot of these bills. So we really need you to bring your experience, your stories, and I know from personal experience from my first Capitol Hill Day with Allergy and Asthma Network last year, the personal patient stories are really what kept the Hill staff incredibly engaged. And we are honored to give you that opportunity to continue doing that. So please bring whatever stories you think would be helpful to illustrate why we need greater funding, we need more accessible medication, why healthcare needs to be more accessible and affordable. Whatever daily challenges you have with your condition would be incredible to highlight for us. And I see a couple of questions, just I want to address that really quick. So Beth, I see that you've asked who you should reach out to with questions. You can reach out to me and I'll provide my contact information at the end. And then will there be accessible options for the shuttle? I will reach out to, we will make sure we include those directives for our upcoming reminder email, which is going to go out on Monday. So we will answer that as well. Okay, thank you. And I'm going to transition to Kevin Schultz, President of Soapbox Consulting.
All right. Thank you, Nisa. Thank you for having us. I'm Kevin Schultz. I'm with Soapbox, and we had the pleasure and honor to schedule your meetings. And I'm going to go over a number of details, such as how you'll find out about changes on the Hill Day, how you'll have live assistance all day while you're on the Hill Day, how to give Nisa and her team feedback after each meeting so that they know how your meetings went. But I want to start with you. So if we go to the next slide, I will show you some of the numbers. The next one has a map with those numbers. There we go. So this is a map of the United States, and you can see that there's about 100 of you coming to DC from 26 states, and you'll be conducting more than 100 meetings in just the span of a few hours. So wear your comfy shoes, you'll be busy. If you see a blue dot on this map, you know you are represented by a Democrat. If you see a red dot near where you live, you know you're represented by a Republican. And it doesn't look like we have meetings with independents this time, but I do give you this background for a couple of reasons, just so that you all know where you're coming from and who you're meeting with. We don't want to bring up politics or we don't want to bring up campaign contributions, so we stay away from that part of it. But we do invite each of our members of Congress to help us. So we're in the legislative sphere, and I just wanted to remind you of that. All right, next slide, please. So tomorrow you will receive an email with your preliminary schedule, and you can open that up and you'll see instructions on how to get into the mobile tool. When you first go in, it will ask for your cell number. The reason we ask for your cell number is so that we can text you with changes on the day of the event. And we call it a mobile tool because it's not an app. Again, it's not an app. There's nothing to download. The mobile tool is simply a website. So you put in your code and you'll see your schedule in real time. You do want to go into the mobile tool when you get that link tomorrow, because that lets you know that you can reply to us with any questions you have about your schedule, or maybe more importantly, you can reply to us with adjustments that you have in terms of maybe you're flying out early, something like that. We encourage you to reply if you have any questions or adjustments. It also helps us because we see that you've clicked in and we know you are definitely coming to the Hill Day. So some of the buttons I want to point out on the mobile tool when you get that tomorrow. And when you're here in town, the most important part for you is that red button at the very bottom. That is how you will have live assistance all day during the Hill Day. If you are in a long line at security and you're worried that you're going to be late to your next meeting, don't worry. Just call us. We'll call ahead and let them know you're on your way. We have 10 people here waiting to help you. So just call us if you have anything that you want to ask us a question about. There's a button for the bios of your members of Congress in case you want to do a little research before you come to DC. There is a button for the map of Capitol Hill, which I will go over in detail in just a couple of minutes. There is a button for documents. So Nisa and her staff are giving us documents that are important to you, and we'll put it in there so that you can have digital copies. You can email them to yourself, maybe email them to a staffer who gives you their email address. There's a button for your team so that you know who you're going to your meetings with, and then a button for your schedule, which I'll go into in detail in just a moment. The most important part of the mobile tool for Nisa and her team is the meeting feedback. So under each meeting on your mobile tool schedule, you'll see that little megaphone icon that you see right here on the left side of this graphic of the mobile tool. You don't have to say who you are. It already knows that because you logged into the mobile tool. You don't have to say which meeting you're talking about because you're pressing the megaphone under that meeting. You simply need to answer the questions. So Nisa is going to give us those questions so that at the end of the Hill Day, we can send her all those answers. That way, Nisa and Linda and Tori and their team can lead the next time they call that office where you left off so that they're not starting from scratch. They know exactly how your meeting went. All right, let's go to the next slide, please. So I want to tell you that one last thing about the mobile tool, and that is you will see a few TBAs when you get that schedule. TBAs are not declines. TBAs are offices that wait until a day or two before to confirm. We can almost name those offices. We know who they are. But I don't want you to worry when you see TBAs. We do expect those to come through. And don't transfer the meetings into your calendar because they change so often. Those of you who have come before, you know that Congress is in flux. They move meetings up, they move them back. So no need to transfer any of that information into your calendar. The mobile tool will update in real time. So let's talk about your printed schedule. If you're more than 50 years old like I am, you might like the old dependable technology of paper. So we will give you a printed schedule once you get to DC, and I'm going to tell you some of the things that are on your printed schedule. Right at the top, you'll see your name and your district, and then below that is our help desk number. So you can call us with any questions. And then on the middle left is that website, the mobile tool website, and your code. So you'll be able to put that in. On the schedule, you'll see if you're meeting with the member of Congress, him or herself, or whether you're meeting with staff. You can see if your member of Congress is retiring or new or maybe a doctor. All those things will be right there on the schedule. And you'll be able to see if your member of Congress is on one of our key committees, which we know is important for you all sometimes to know before you go into a meeting whether your member of Congress is on one of our key committees. If you're not sure of any abbreviations when you get that schedule, you'll just look at the bottom there and see what they stand for. All right, let's go to the next slide, please. Again, when you get to town, you'll get this printed schedule, and all you have to do is flip it over on the back, and you'll see a map of Capitol Hill so that you can read your schedule, see the building it's in, flip it over, and this is what you will see. So a few things about the map that I want to point out. We mark the accessible entrances. The ones with a wheelchair are the accessible entrances. We also add all of the entrances. So those little shaded boxes are the doors to each office building. And then we've marked if there's food or coffee in that building. And then there's estimated walking times between the buildings so that you know how long it takes to get from one meeting to the other. I want to point out to you, those of you who have never been here before, the Senate office buildings and the House office buildings are all connected by basement hallways. I bring that up because once you go through security in one of those buildings, you don't want to have to go through again if you're going over to another Senate building. So just go down to the basement and over, and then you'll be able to get there much more quickly. The Senate office buildings are 1 block north of the Capitol, and that's the side we're on at the hotel. And the House office buildings are 1 block south of the Capitol. Again, all connected by basement hallways so that you can get to your next House meeting quickly. When you go from the Senate to the House, most people walk it. It's about a 5 or 6 block walk by the Supreme Court, by the Library of Congress, so it's a pretty walk. But it's not uncommon for some people to take a cab or an Uber if you need to do that. That is not a problem at all. You'll find cabs outside. And of course, you can find an Uber easily and take it over to the other side if you need to. I want to mention timing. So we've asked for each of your meetings to be 1 hour apart. So we have asked for that. If you notice 30 minutes between meetings, you'll notice it's on the same side of the Capitol. So you're going from one Senate office to the next Senate office. You will have time to get to that. You can start your first meeting with, we have a meeting on the half hour. We're happy to keep this to 20 to 25 minutes. The staffer will find that very gracious and they will be happy to oblige. And then you'll have time to get over to your next meeting. Our backup plan will be you'll call our help desk if you're running late. Final thing about this map I want to point out. So security has gotten a little tighter this year in terms of bags. So you're going to go through a metal detector for each office building. But sometimes folks bring luggage, and they're now starting to screen that out and say you can't take luggage. A messenger bag, a purse, or a backpack is perfectly fine. It will go through the little conveyor belt, but just remember to not take luggage up there. They may stop you. All right, next slide, please. A couple of tips before I hand it back to Nisa. So you're establishing relationships on the Hill. I just want to mention that staff. Remember that staff are the ones who reply to our emails. They are the ones who call us back when we call for an update on our legislation. So we definitely want to build those relationships with staffers. At the end of the day, Soapbox will add the email address of each staffer you met with. And if you met with a member, it will be the scheduler's email address so that you can follow up with a thank you or any follow-up if you like. So just know that we will be adding those to your mobile tool at the end of the day. No video or audio recording. It's always okay to take a photo with your phone. Just ask ahead of time, and the offices always say yes when you ask. But they don't want us to record. So we don't want to use a video recording or an audio recording, even if it's for our own notes. Let's just keep our phones in our laps because they get a little anxious in this day of social media if you record anything. And then these meetings have official rosters. So the reason I bring that up is because giving an office an official roster is how we can schedule every year or every day and go back to them because they appreciate that we're telling them who is coming. So if you can't make a meeting, it's perfectly fine. You'll just call our help desk and we'll call to the office and say that we have an updated roster for them. They very much appreciate that. It also prevents a no-show so that if somebody can't make a meeting and no one makes it, we know that and we can tell an office before a no-show happens. All right, next slide, please. So this is my name, my email address, and my phone number. We can keep it up there for a sec in case you want to write it down. Remember, when you get your preliminary schedule tomorrow, our email address will be right there too, so that you can reply to us with any adjustments that you have. And with that, I'm excited you're coming to town. I look forward to meeting you next week, and I will hand it back to Nisa.
Thank you, Kevin. So this is the end of our presentation. I wanted to just go to the next slide real quickly. If you need my contact information, it's right there. I do see a question in the chat, and that is each advocate part of a team or everyone is meeting on an individual basis? You'll be assigned teams based on your congressional district. So your team size may vary across the board, but you will be with other individuals from your state and your specific congressional district. And then Jamie asked, is there a primary room we can go to in between meetings? Is there somewhere we can leave our luggage on the Hill? I don't think there is a place you can leave your luggage on the Hill, but you can store it at the hotel. While you're away, you'll probably have to check out sometime in the morning anyway. So if you're staying at the hotel, you can do that. If you're not staying at the hotel, then please email me and we'll try to coordinate something for you. There's also no primary room designated to wait for your next meeting. You can either, if there's a cafeteria downstairs, you can go there, or you just have to wait until the next meeting that you have. There are some meetings that have larger gaps in time, so if you have questions about that once you receive your schedule on what you can do in between, I can help with that as well. And I think those are all the questions we have, but I'll stay on for just a moment to make sure anyone else has questions. Again, thank you very much. We're looking forward to meeting you all in person and to hearing your stories and to see how these conversations unfold. And there's another question to clarify. The meetings are all in different buildings, not at the Hilton. Yes, the meetings will be on Capitol Hill. You will either be meeting with Senate offices or House of Representative offices. The briefings, the breakfast briefing is going to be at the hotel. The Tori, could you do me a favor and go back to the agenda just so that I can highlight this? Right there. Thank you. So at the hotel itself, we're going to have two events if you're registered for those. That's going to be the welcome reception the night before, and then the next morning we'll have our breakfast briefing, and that's going to be at the same location. Then we're going to break for the day. That's going to be our last event, the breakfast briefing at the hotel. Then next, we're gonna go straight to the Hill from the hotel for the media opportunity and photos, and then we'll go to our meetings. The next event is going to be our congressional lunch briefing. That's going to be at the Rayburn House office building. That's where everyone's going to meet up again at the same location. And then after that, we're going to break up again to finish up our meetings. So everyone will have meetings throughout the Capitol. So the meetings with Hill staff are going to take place on Capitol Hill.
Nisa, I just remembered something that I know
Sure.
Linda and you wanted me to say, and that is that if you do not receive your schedule tomorrow afternoon, please let Nisa know so she can tell Soapbox and we can resend it to you. We know that's important that you get a chance to look at your schedule before you come to town.
Thank you.
Lisa, this is Linda. I'm just wondering if you could put up the map of Capitol Hill
Mhm.
to address the question that somebody had regarding, it wasn't that one, it was the one I think Kevin put up about where all the office buildings are.
There it is.
So there you go. So I don't think we have a pointer or anything, but if you look in the upper third of this, there's three office buildings along Constitution Avenue. Those are the Senate buildings. And then you'll see the US Capitol building in the middle. And then there's three buildings at the bottom of this image, and those are the House office buildings. So the meetings that Kevin is scheduling you to go to are going to be in one of those six buildings. And then you might have to run back and forth between meetings to go to a different building, depending on what your schedule looks like. And that's what Kevin was referring to about if you have multiple meetings in, say, different house office buildings, you'll want to go into the basement and walk through the connected tunnel to get to your other meeting because you don't want to have to go through security again. And it's the same way with the Senate buildings. You can go to the basement and walk between those buildings as well. I got that right, Kevin?
You sure did. Thank you.
Yeah. And then one other thing, it's hard to point out here, but at about 7 o'clock, 8 o'clock on this square, if you were to think of it as a face of a clock, they're in front of the Capitol building, which is on the left side, is going to be where you'll get dropped off if you're going to take transportation, from the hotel to get there. And then you'll be walking around to the front, the back of the Capitol for the photo opportunity if you want to join us there for photos. I think that's going to be at 9:30, right, Nisa?
Yes, that's going to be at 9:30.
Yeah. So that's why we're saying wear comfortable shoes because there'll be a lot of moving around and trying to get to your next appointment on time.
There is another question. If there's anything on the 7th, or can folks fly out on the 6th? There's no programming on the 7th. So the 6th is our last day. The other question I want to address is, does the basement access have stairs? Asking for accessibility planning. So there's elevators in every building, and then the rest of the path in the tunnel is a ramp, a flat path. And confirming with Kevin, there aren't any stairs because when I've been there, it's mostly been a path.
Yeah, you are correct.
Okay.
And if you have other questions about accessibility, contact Marcella Hiamiani, who works for us. I put her email address in chat. If you don't have ready access to it, just contact Nisa or me.
I put her email in the chat as well.
Thank you, Nisa. I appreciate you put that in chat.
No problem.
We're looking
Okay.
forward to seeing you next week. Thank you for signing up. And it's always a fun day for everybody, especially if it's your first time on the Hill. It's a really great experience and you'll leave feeling really empowered. And Kevin does a really good job of keeping everybody going in the right direction. He's got you have Kevin and his team on speed dial if you have any questions.
That's right.
Great. Thank you, Kevin, and thank you everyone for joining. Really appreciate everyone's time. And looking forward to seeing you in person. Thank you.